So the next session is the quiz here, and we would like to thank Ajanta Pharma for the quiz. Can we have the video? Please play the video first. So this is going to be done on Kahoot platform, so please download the Kahoot app. I would like to invite the quiz masters, Dr. Prashant Bhavankule, Dr. Santosh Honawar. You can keep the prizes here plus. So the first prize is a laptop, the second prize is a iPad or a tablet, and the third prize is a digital watch. Sai, can you come here? Okay, so the rules, everybody is ready? Should we start? So the rules of the game are download Kahoot app from www.kahoot.com. You can play on .it. You can play on www.kahoot.it on browser. 20 seconds will be given for each question. Scoring will be done by Kahoot. Add your mobile number in the nickname for player identification. And of course, the quiz masters, which is all three of us, our decision is final. You can start joining the platform, please. Not coming. Internet.
No, it just takes a little bit of time to join, but once joined, you'll be able to play. It just takes a little bit of time to join, but once you join, you'll be able to play continuously.
So I can see people are joining here.
When you press next, the option will pop up and 20 seconds time will start. I thought I should show it to you busy. Yours only 14%.
I have done my thing. I thought I'll go first and then do, but वहाँ इतना delay हो गया कि वो वाला हो गया. So not everybody is joined because showing me 27, but there are more than 27. Is there any problem? Any problem? Somebody? Can you give them the hotel internet. Wi-Fi connectivity is issue. They can give the username and password of the hotel, no? नहीं, they have been given ना, कुछ दिया तो है, बूपी कहाँ है?
How many are yet to log in?
How many of you could log in? Raise your hand.
How many could?
How many are trying and not able to?
Quite a lot. Boopi?
Sai?
Sai, you have the username login. You can give the hotel's username login. You have no? You can give them for whosoever it. Huh? Okay. रूबी जी कहाँ से आए? ज्वाइन हो गया? Anybody is having a problem in joining? All of you have joined? Any issues with joining? Only one? Acha. Sai, can you help that side? Two people need help. Then we can start. कौन? विनीत? क्यों? अरे बिल्कुल भी नहीं. Anybody, has everybody joined? Any problem? 1, 2, 3, 4. So Sai, please can you help them? क्या टाइम है? 5:15. जनरल क्वेश्चन का रटना है मैंने एंटीरियर सेगमेंट रटना ओकुलर टेस्ट
So are we ready? Anyone left out? Sai, yeah.
1 and 2. So 2.
Just walk ahead so that Mr. Sai can help you. People who couldn't log in, just walk ahead, please. Sai is helping you out.
हो गया साई डन हाँ okay so I'll go through the rules again. Download Kahoot app from www.kahoot.com. Can play on www.kahoot.it on browser. 20 seconds for each question. Fastest fingers first. Scoring done by Kahoot. Add your mobile number and nickname for player identification, and of course our decision is final. So we will start. Which of the following is not a mechanism of action of lifitegrast? Binds to LFA antigen, inhibits activation of B cells, disrupts LFA CAM interaction, inhibits activation of T cells. Okay, inhibits activation of B cells is the correct answer, and I think not most of you, but majority have got it correct. So we go to question 2. What happened? Can't join. What is the mechanism of press biopic inlays? Increased corneal thickness, pinhole effect, induced multifocality, reduced corneal refractive power. So the correct answer is pinhole effect. Again, majority have got it right. So the next question is, what is not true about lattice corneal dystrophy? It is also known as Bieber-Habs-Dimmer dystrophy. It is associated with TGF beta 1 gene. TM shows 8 to 10 nanometers diameter randomly arranged fibrils. It is associated with 5q20 gene. Okay, so what is not correct is that it is associated with gene which is 5q20. So this is a theoretical question. You have to give in between because otherwise you will mark everything correct. So 5q31 is the associated gene with lattice corneal dystrophy. False about Descemet's membrane. It is made of collagen 4 and collagen 8, 5 to 10 microns in thickness. It is the site of iron deposition. Bubble anterior to Descemet's membrane is type 1 bubble. Okay, interesting. So the correct answer is, it is the site of iron deposition, which is actually false about the Descemet's membrane, because it is the copper which gets deposited in patients with Wilson's disease there, and it leads to the formation of the KF ring. So the next question is, what drug is FDA approved for Demodex blepharitis? Tea tree oil, lotilaner, azithromycin, HOCl eye wipes. So the correct answer is lotilaner, although tea tree oil is the one which we commonly use, but this is not FDA approved. 0.25% drops are administered twice daily for 6 weeks. So the next question is, what is creatine plus protocol in the management of keratoconus? Transepithelial PTK plus PRK plus CXL, PRK plus CXL, transepithelial PTK plus CXL, transepithelial PRK plus Intax plus CXL. So the correct answer is transepithelial PTK with PRK with CXL. Which of the following is not a CLEX procedure? Smart Sight, Clear, Silk, Smart Classic. So Smart Classic is not a CLEX procedure. All the other three are lenticular extraction procedures by different companies, but these are the brand names. The recent changes in IC3D classification for dystrophies include all except adds PPPCD, adds new variant of granular dystrophy, adds new variant of lattice dystrophy, adds epithelial recurrent corneal erosion dystrophy to the category. So the answer is adds new variant of granular dystrophy, which majority have not got correct. So the next question is, what is true about Dua's layer? It is 30 micron thick pre-Descemet's layer. It is predominantly made of type 1 collagen. It is predominantly made of type 6 collagen. It has abundant hyaline. So what is true about it is that it is made up of type 1 collagen. So the next question is, which of the following is not true about pythium keratitis? It is sparsely separate aquatic comycete. Satellite lesions are hallmark. Tentacle-like infiltrates are characteristic. Topical linezolid and azithromycin remain first line of treatment. So what is not true is satellite lesions are hallmark, because for pythium keratitis it is the tentacle-like infiltrates which are characteristic, or reticulate pattern which is characteristic. Which of the following steps would be avoided in this type of cataract? I think this is very simple. This is a picture of OCT. Which of the following steps you would actually avoid in this type of cataract? Making a triplanar incision, making a 5 mm excis, hydrodissection, hydrodelineation. I think everybody should get this correctly. So most of you have got this correctly, hydrodissection, although some people still have got it wrong. So the next question is, what is the FDA approved concentration of cinegermin? So in every quiz you would have a question on cinegermin. So these are the concentrations which are shown and which is FDA approved. So some topics are very common. Dua's layer, cinegermin. Okay, 0.002%, which is the correct answer. What is the only FDA approved drug for evaporative dry eye disease? So these are all the perfluoro compounds. Which of them is FDA approved for evaporative dry eye disease? This is not retina, this is dry eye disease. All of them are perfluoro compounds. So it is perfluorohexyl octane, which is approved, not available in India, but will come very soon. Which is not a part of OSDI questionnaire. I think this is again very simple. Eyes feeling gritty, poor vision, windy conditions, frequent redness. So frequent redness is not a part of OSDI. And coming to the last question from this round, from the anterior segment round, identify the English ophthalmologist who was awarded England's highest honor by Queen Elizabeth II in 2000. Roger Stennett, Sir William Stewart Buchalter, Sir Harold Ridley, Jordan Hill. Okay, so it is Sir Harold Ridley. So we come to the end of this section. Any questions? How would you do it? How would we do it? Quiz questions कैसे करेंगे बीच में? Audience questions. चलो ठीक है तुम करो.
Conclude next. We'll conclude.
No, I know, but result
Can we show the
Can we show in the between?
No. They will know on their mobiles. They know their status on their mobiles.
Okay.
You show only at the end.
Only they will get it. Kahoot doesn't show in between.
Yes. Every question also can set. I have done it.
Okay, anyway, we'll continue with the next segment, which is going to be, you can guess, Dr. Prashant Bhawankule, so it is the retina segment.
So I see a lot of familiar faces here. Some of the people are very greedy, like Vinay, and I see one more guy there who will always believe in pocketing all alone. Such selfish people will be outcasted by our systems. Remember, Vinay. Okay? Chalo, best of luck to all of you. I will be with you for next 15 questions. So everyone ready?
Yes.
Rolika and team. Are you ready? हाँ चलो यार अब तो कुछ करने में मज़ा आएगा ना, नहीं तो कोई मतलब ही नहीं है. ओके, गो विद द फर्स्ट क्वेश्चन. अरे यार क्यों नहीं रहा है? नहीं, आई डोंट नो. हाँ नहीं आ रहा ना मैडम. हाँ ओके ओके ओके. So this is about RDN ratio. The RDN ratio in an electrooculogram is used to assess the function of which retinal layer? ये क्यों ऐसा आ रहा है? Okay. Yes, anyone from the audience before I reveal the answer? Revealed. Are yaar, ye na system is so fine. So you know the correct answer. It is retinal pigment epithelium. Okay, let's move to the next question. In FFA, that is fundus fluorescent angiography, which phase comes immediately after the arterial phase? Very simple question. Okay, so the correct answer is arteriovenous phase. Well, you can see it. And so let's move on to the next question. Obviously, my questions are quite easy. Which of the following drugs is contraindicated in patients with history of retinal detachment? And here is your questions. Is it pilocarpine, timolol, tropicamide, or atropine? Unlike the two other my quiz masters, I have kept very easy questions for you. And so you remember, whenever it comes to voting, always vote for me in favor. Fine, pilocarpine. Let's move on to the next question. Which of the following is not a feature of weak age, that is Vogt-Koyangar-Harda syndrome? Is it sunset glow fundus, tinnitus, retinal detachment, and optic neuritis? Which anti-VEGF agent has the longest intraocular life? Is it bevacizumab, ranibizumab, aflibercept, or pegaptanib? Well, one of the molecule is not now in vogue, but so it is aflibercept, correct? Which of the following is most suggestive of optic disc edema rather than the pseudopapillary edema? So how do you differentiate amongst this? And this is of the four features, which one of them helps you? Blurred disc margin, absence of spontaneous venous pulsations, small crowded disc, and a normal visual acuity. Well, it is absence of spontaneous venous pulsation. Rest can be affected. So next, let's move on to the seventh question, and that is, look at the OCT. Which of the following OCT feature is most predictive of poor visual prognosis in diabetic macular edema? That is OCT biomarker of poor visual recovery after treatment as well. Well, it's disruption of ellipsoid zone. Look at the OCT, and the double layered sign on OCT is most indicative of what? And these are the options for you: PCV, classic CNVM, RD, or an optic pit maculopathy. Yes, almost everyone, 56%, 56 people have answered it correctly, and it is of course PCV. Next question, the hypopion sign in FFA is associated with one of this. Which one is it? It's a coats, serpiginous choroiditis, VKH, or APMPP. So it's APMPP. Almost 47 people answered it very right. Good. So now let's move on to the next question. The pathognomic histopathologic finding in CMV retinitis is it onion scale layering of retinal layers, Cowdery type A intranuclear inclusions, or is it a rosette formation or an amyloid deposits? Yes, it is the Cowdery type A intranuclear inclusions. Almost 63 people answered correctly. Let's move on to the next question. So you can see on the optic nerve head the optic pit. Optic disc, the characteristic feature of optic disc maculopathy on OCT is, and these are the 4 options for you: schisis, retinoschisis, that is epiretinal membrane, macular hole, or a vitreomacular traction. Yes, it is retinoschisis. So once you have a retinoschisis and a deterioration of vision, you have to consider treatment. So now let's move on to the next question, that is, which structure is primarily affected in choroideremia? And here are your options. It's a ganglion cells, or a choriocapillaries, or a RP and choroid, or an immune nuclear layer. So it's RP and choroid. There was a tie, I believe, in the answering pattern. You can see choriocapillaries, almost 35 people answered versus RP and choroid, which was the correct by 41 people. It's almost close. So now let's move on to this is an explanation for you. Okay. The classic ERG finding in X-linked juvenile retinoschisis is options: absent A and B waves, electronegative ERG, supernormal B wave, and or a reduced photic response only. Well, it is 52 people answered correctly. It's a reduced B wave with normal A wave, that is electronegative ERG, which happens in X-linked juvenile retinoschisis. So last but one question from me. In retinal photocoagulation for PDR, which structure is most at risk of damage? So here are your options. Is it the optic nerve, or the fovea, or a retinal pigment epithelium, or a choroidal vessel? Very easy questions. Well, it is retinal pigment epithelium. Very rightly answered. Very well said. Almost by 43 people. Fine. The last question from my end. The hallmark of retinal ischemia on OCT angiography is choriocapillary dropout, SRF, enlarged foveal avascular zone, and hyperreflective outer retina. Well, very well answered. It is enlarged foveal avascular zone, answered by almost 64 people. Well, now my turn is over. Now let me welcome a very avid quiz master, our own General Secretary of AIOS, Dr. Santosh Shonawar, for the next set.
Thank you. Some serious questions coming up next. All right. Okay. Who does this eyelid reconstruction procedure? Whose name does this eyelid reconstruction procedure go by? We'll have the choices next. Tenzil, Hughes, Mustardi, or Frick. As you see, it's a lower lid transposition flap to reconstruct upper lid coloboma. Correct answer is Mustardi, and maybe 1/3 of you have got that right. Next question. Which of the following papillomatous lesions of the eyelid is pre-malignant? Acanthosis nigricans, seborrheic keratosis, actinic keratosis, verruca vulgaris. Actinic keratosis is the correct answer, and I think majority of you have got that right. That was a very obvious choice. This sign is not seen in. This is a sagittal reconstruction of a CT scan not seen in optic nerve sheath meningioma, perioptic hemorrhage, perineuritis, optic nerve glioblastoma. That was tram track sign, and it is not seen in optic nerve glioblastoma, where you don't see the optic nerve running separate in intensity from the rest of the lesion. What is the possible diagnosis of this 3D reconstruction of CT scan? Orbital fracture, orbital emphysema, neurofibroma, post-orbitotomy situation. That's a bare orbit of neurofibroma. Wasn't that obvious? Sphenoid wing dysplasia. All right. So identify this instrument that we currently use in oculoplasty. Monocanalicular intubation, canalicular trifine, balloon dacryoplasty set, Jones tube intubation set. That was Sizzler's canalicular trifine. That's the correct answer. Well, you are familiar with this drug, right? Oculoplastic side effect of ROCK inhibitors is conjunctival hemorrhage, punctal stenosis, eyelid pigmentation, or eyelash lengthening. Conjunctival hemorrhage is the correct answer, least answered question. In fact, we had a patient a couple of months ago. Confluence of which veins is superior ophthalmic vein? Choices come up next. Angular, medial palpebral, supraorbital, supratrochlear, angular, supraorbital, supraorbital, supratrochlear, and angular. Superior ophthalmic vein. The correct answer is supraorbital, supratrochlear, and angular. That's superior ophthalmic vein. World Retinoblastoma Awareness Week is observed in, on, or from first Sunday of May, second Sunday of May, May 7 to 14, October 17. It's the second Sunday of May. Dates are not fixed, obviously. Question 9 coming up. Fuchs adenoma, all are true except tumor of non-pigmented ciliary epithelium, most common intraocular tumor, asymptomatic, associated with Faces syndrome. All are true except. Correct answer is that it is not associated with Faces, so that is the correct answer. It is asymptomatic, the most common intraocular tumor, but obviously after in autopsy eyes it's not detected because it's hidden and it remains asymptomatic. All are true except this condition. Looking at the picture, most common cause for spontaneous hyphema in children can occur in the eyelid. Excision is the treatment of choice. Secondary glaucoma is a feature. Well, excision is not the treatment of choice. Topical steroids, systemic steroids are. That was juvenile xanthogranuloma. Wales classification is used for which disorder? Retinal capillary hemangioblastoma, Coats disease, intraocular lymphoma, or chirpy. The answer is retinal capillary hemangioblastoma. That's Wales classification. Question 12 coming up. If you have a patient with this patch on the hand or leg, what is the ophthalmic feature the patient is most likely to have? Pyogenic granuloma, astrocytoma, capillary hemangioma, corneal keloid. Correct answer is astrocytoma. That is a feature of tuberous sclerosis that you saw cutaneous manifestation. What is this instrument used for? The picture that you saw on the screen. Eyelid massage, ptosis surgery, chalazion surgery or entropion surgery. I think few thought it was for eyelid massage. 13 of you. It's actually used for ptosis surgery. That's ptosis clamp. Question 14. Identify the surgery common to all these celebrities. What surgery have they undergone? I'm sure you're all recognizing them and kind of. Surgery common to all these celebrities. Ptosis, blepharoplasty, LASIK, squint. Well, they have all undergone blepharoplasty, so I think that was a very obvious choice. I think I'm done with those my set of questions. Sai, can we have the results? Top 10, top 5 will come up for the final rounds quickly.
Results? Yeah, quickly. शर्मा जी आप अपना वीडियो नहीं वीडियो दिखाना उसको चलो वीडियो चला दो तब तक विल जस्ट डालो जल्दी डालो अरे ऑडियो नहीं आ रहा
TG, SSSS, PKB, Shilpi and Archana.
कहाँ पे
Shilpi, Archana, SSSS, TG and PKB.
नहीं कोई बाहर नहीं है जिसने जीता है वो अंदर इधर ही आएगा हॉट सीट पे ताविश विनीत शिल्पी ऑल्सो एंड who's SSS Tavish TG and VKB 3
Last two. Again. VKB. Again, who is VKB?
VKB आ गया विनीत
SSSS. Okay. TG.
ताविश आ गया
Okay. Shilpi and Archana.
ये दो तो इसी साइड से हैं दोनों तीन उस साइड से हैं दो उस साइड से हैं
Make sure that all your mics are on and keep a fire with
अरे आ जाओ उसको मत धमका प्रशांत हाँ, हमारा वीडियो ऑफ अजंता फार्मा चल गया शर्मा के 5 क्वेश्चंस का है, तो वो भी चला दें अभी, वो चला दो पहले. देयर आर 5 क्वेश्चंस. चॉकलेट्स तो दिए नहीं किसी को भी. वो 5 क्वेश्चन इनके चला. होते ऐसे ही पूछ लो. Just put PowerPoint. Just put it on PowerPoint and we'll ask the audience and they'll fly the chocolates. है ना? No need to do on Kahoot. वही मैं कर वही. So the audience quiz actually starts now. कौन सा है? So the question is, video बंद कर दें? He's put it like that. Okay. Okay. Let us. What happened?
Again they have to scan?
They have to. No, they'll answer like that only, and you. So the founder of the Rotary Foundation is Paul Harris, Sylvester Shell, R. Klump, or Hiram E. Shore. Not for the finalists.
हम नहीं कर रहे फिर.
Chocolate. ये बल्ला जी. So the next question is,
Dr. Vikas Gupta.
पता नहीं, मेरे को भी नहीं पता.
can Ajanta people please give the flying chocolates to the winners from the audience? To become Paul Harris Fellow, the contribution to TRF is
$1,000.
to become Paul Harris Fellow, the contribution to TRF is $100 US, $1,000 US, $10,000 US, 25,000. Right? This is a different quiz? My God. Ajanta Pharma is wondering what has happened to their
Change the
questions.
screen.
This is a Rotary Club, Sai?
I don't know what it is.
Chocolate wapas. I am wondering why is Ajanta talking on Rotary? उनके अपने products. See, this is what happens when you engage in too many quizzes. So recognize the innovator that has introduced more than 47 molecules first time in India. I think all answers are going to be Ajanta Pharma only. Now I have to wait for 20 seconds and that is, it doesn't go, it's skip. Recognize the innovator, okay, that's okay, done. Then, which of the anti-glaucoma molecule works on trabecular meshwork outflow? They'll make you remember their products now.
Yeah, please.
Chocolates.
सबको देना पड़ेगा इतना लोगों ने करेक्ट आंसर दिए हैं
Just
10 लोगों ने बोला है
Okay. Name the lifitegrast brand from Ajanta Pharma. Chocolates बांटते जाओ आप एक लाइन से सबको. Which is the number one prescribed company in ophthalmology in India as per? Name the organization that.
Ajanta Pharma.
अरे शर्मा जी आंसर में अपने प्रोडक्ट का नाम तो लिख लेते. अजंता फार्मा से मतलब दे विल रिमेंबर ओनली अजंता फार्मा, नॉट रिमेंबर द नेम ऑफ द प्रोडक्ट. ये भी अजंता फार्मा है क्या? विच ऑफ दिस ब्रांड बिलोंग्स टू अजंता फार्मा? ऑल ऑफ देम भी नहीं होना चाहिए, ऑल ऑफ देम भी नहीं होना चाहिए बिकॉज दे विल नॉट ट्राई टू रिमेंबर योर ब्रांड्स. Okay, thank you for participating in this Ajanta Pharma quiz.
जल्दी कर. नहीं चला दो. Yeah, there are two special rounds here, progressive clues and in Jaldi 5. In progressive clues, we ask a question with a header, and the first clue, if you're able to crack the answer, you'll get plus 15. And if you answer it wrong, you'll get minus 10. This is for the top finalists. Prashant. And if it is with the second clue, then it is plus 10 or minus 5. And with the third clue, it is plus 5 or 0. So third clue, if you crack it, there is no negative marking for not cracking it correctly. And Jaldi 5, plus 10 or minus 5, 5 questions will be asked and answered in 1 minute. That is the quiz. Progressive clues will consist of a header and a clue, first clue. All right? So whoever knows the answer should write it down on the piece of paper. Prashant will come and check. Right? We won't reveal the answer at the end of each clue. All right? So plus 15, minus 10. Prashant, you have to go and check. Right? You're all set? Don't answer on the mic. Audience, please don't prompt. This is, yeah. Right. This also has a score. I mean, this is included. Clue 1. A playful French boy wounded his right eye with a cobbler's tool in his father's harness making workshop at the age of 3 and lost his vision. We are talking about either the name of the person or the disease. Any of you? No? No, audience नहीं, पूछना नहीं. Last में पूछना. Name of the disease or the person? Name of the disease or the boy? हाँ. बोलना नहीं, विनीत. जो आंसर क्या है हाथ ऊपर उठाइए. प्रशांत को पता है. Two of you have answered it correct, I believe. And let's go to the next clue. His left eye became inflamed a few months later, vision deteriorated, and the boy was completely blind by the age of 5 years. Same answer. With the second clue, if somebody cracks it. आएगा थर्ड में तो आएगा. If they have answered it correct, yes. Okay, third clue. That script and the translation of the script. So now you get a clue. Who could be the person and what would be the disease? Audience? Louis Braille is the correct answer, and the disease was sympathetic ophthalmia. Okay. Yeah, disease or the name of the person. Then that's fine. So whoever gets plus 15, you mark it as plus 15, and whoever answered wrong, you get minus 10. Yeah, 15, 15, 15. Nobody answered it wrong. Plus 5. Yeah. Yeah, 0. Okay? No, abhi hoga na already. Yeah. The next one is, in 1940, Mann and Kellen discovered this drug and recognized its anticonvulsant property against focal and generalized seizures. It is now repurposed and is widely used in ophthalmology. Name the drug. Anyone? Raise your hand if you have answered it quickly. Nobody? Okay, we'll go to the second clue. Beginning 1960, it was used extensively to treat peptic ulcers. Now it is used in ophthalmology very extensively. Raise your hand if you have answered it. No. Third clue, it is also used anecdotally for the treatment of CSCR. The same drug. But that's not its main purpose. Name the drug. Raise your hand if you have answered it. Audience? No. Used in glaucoma. Acetazolamide is the correct answer. Minus 10. थर्ड क्लू में रहोगे तो 0. थर्ड क्लू में माइनस पे नहीं देते. Whoever did not attempt in the third clue gets 0. Whoever answered it wrong in the third clue also gets 0. Third clue में minus नहीं है. Okay? Sure, no? You have got it right. Okay.
Excuse me?
Progressive clue next. Very important, Panch. Of all the Indian postgraduates who have been at Moorfield since the war, there has been no keener man, no man who has done better in his examinations or worked harder to gain experience in every branch of the subject. This was told about an Indian ophthalmologist by the Dean of Moorfields. Who is this person who he is referring to? An Indian ophthalmologist who is no longer with us.
No longer with us is the key hint. No longer with us is more important.
Next clue. We'll go to the next clue. He planned the first national program for the prevention of blindness in the world.
तो बहुत simple हो गया.
Okay. Third clue. He was featured on the cover page of IJO. Nobody? Audience? Absolutely right. LP Agarwal, the founder of RP Center. Most of us would know him.
एक भी आंसर नहीं किया तुम दोनों. LP अग्रवाल.
देखो यार. Next one. Progressive clue. Yeah.
So if they go, इसको इसे किसी ने विनीत ने किया, है ना? Plus 15 हो गया, बाकी सबका 0 ही हुआ.
Yeah. With this clue, if you are able to answer, you get plus 15. Sheriff of Nottingham and the badge. Vineet, क्या हो रहा है? बस स्मार्ट है.
बहुत smart है. इसका saved है मेरे फोन में. Best JR.
Clue 2. पहले 5 थे. There were only 5 before. That's the second clue.
अगर फर्स्ट को में ही पूरा आंसर आ गया तो फिर doesn't matter ना.
Third clue. Third clue. Whoever wants to answer.
सबने कर दिया होगा.
तो क्यों नहीं यार? तो भी नहीं. अरे? Audience. Dr. Dua is the correct answer. Plus 5. Dr. Dua is the correct answer. Yeah. Just this CD and the name Kerry Adams, does it ring a bell? Very famous ophthalmologist. We are earning our bread and butter because of him. Name the ophthalmologist.
Anyone? No. Let's move on to the next.
Second clue. Cryo extraction of the lens. That's one of his discoveries. He's not known for it though, unfortunately. Third clue. Don't prompt, please. Okay. Last question. He was born in a small village, Litran of Punjab, and he did his medical schooling and all that, and became a professor of anatomy in Government Medical College, Patiala. Do you know this individual? But he's an ophthalmologist. Dr. Bhallaji, आप नहीं अभी. Do you know this individual?
Anyone?
No? Okay. Second clue. His audience, please don't prompt. I know you're very smart. नहीं? Okay. Third clue.
ये तो simple
Audience, don't prompt, please.
तो कर लेंगे.
नहीं? Audience? Yeah, Son Singh Hare is the correct answer. So now we'll go to Jaldify. I think Namrata, you can conduct it. Just have to go read those 5 questions.
Want to tell us that?
Yeah,
Shall we?
Prashant, you can announce the scores at this point.
15, 5, 20, 25. अब तीसरे का 15, 5, 20, 25 इसका भी है. लिमिट के हिसाब से 15, 10, minus 10 है. नहीं इसका minus 10 है. 5, 20, 35, 50. Plus 10, plus 10.
7.
5 plus 10.
10.
इसका 15.
20. Announce करो.
So right now Vinith is leading the chart with plus 70. Then on number 2 is Dr. Shilpi and Shalin on with 25 marks. On third, then Pravish is with plus 10 and Archana is with plus 20. So 70, 25, 25, 20 and 10.
Yeah.
We'll start with the person sitting first, Shilpi. Okay, you ready? You have to answer into the mic, and if you don't know, you can say pass, plus 10 or minus 5. All right? 1 minute total. Yeah. Ophthalmic artery is a branch of?
Posterior ciliary artery.
Wrong, it's internal carotid, minus 5. Spot of Marriott is also known as?
Pass.
Blind spot, 0. To which group of drugs does amphotericin B belong to?
Antifungals.
Polyene group, minus 5. The dioptric power of a biconvex lens with focal length of 25 centimeters is?
52.
Plus 4 diopter, minus 10, minus 5. Sorry. What is the size of each small square in Amsler's grid?
5 degrees.
5 by millimeter by 5 millimeter. I'll give that to you. So if ophthalmic artery, minus 5. Spot of Marriott, you passed. Fungus, you said minus, again wrong answer, minus 5. Dioptric power, minus 5. And plus 10. So you get minus 5 total, right? Yeah. So Namrita will do the second one.
The lens develops embryologically from
Surface ectoderm.
basic aqueous secretions are chiefly from
Accessory glands.
accessory or lacrimal glands. To which group of drugs does ketoconazole belong?
Polyene. That's a hematose. Okay.
The distance between two foci in a Strum's conoid is called
Pass.
focal interval of Strum. One more. Anatomic site of lesion in bitemporal heminopia is
At the optic chiasm, a cellular mass in optic chiasm.
optic chiasma. Total score? Accessory answered. 3 is minus. Vineet, are you ready? The volume of AC and PC is about
AC is 200 microliters, 4 ml.
0.23 plus 0.06, 0.31 cc. Name the authors of trichromatic theory.
Helmholtz.
Young and Helmholtz. What is the pharmacological mode of action of atropine?
Pass.
Parasympathetic. What is the visible range of wavelength of light?
400 to 700 nanometers.
397 to 723. Okay, we'll give. An atomic lesion in optic tract produces this field effect.
Pi on the
Homonymous heminopia.
So minus 5, then 0, then pass, minus 5, ये वाला 4, then plus 10.
Name the pigment present in cones.
Iodopsin.
Iodopsin. Ipsilateral 6th and 7th nerve palsy with contralateral hemiplegia is
Benedict.
Millard-Gobler syndrome. To which group of drugs does ciprofloxacin belong?
Fluoroquinolone.
Fluoroquinolone. What is the color of sp2
Pass.
glass? Pink. An atomic site of lesion in a patient with quadrantic homonymous field defect is most probably
Parietal lobe.
temporal lobe.
Quadrantic can be parietal or temporal. It can be both. Superior, inferior, quadrantic, it was not mentioned.
yes.
Who is master's decision?
It's fine.
Let's move. Last.
Which part of retina is thickest? Foveal rim. Visual hallucinations that occur in patients with visual acuity loss or visual field loss is called which syndrome? Charles-Bonnet syndrome. Which group of drugs does acetazolamide belong to? carbonic anhydrase inhibitor. What is the thickness range of the Fresnel's prisms? 1 to 5 millimeter. Lesion in temporal lobe that results in damage to Meyer's loop causes which characteristic visual field loss? Pie in the sky. Okay, so I think we come to the conclusion. Shall we now compile all the... One, two, three you have to get, huh?
Is 70.
So you announce the result.
So on number 3, that is second runner-up is going to be on Dr. Archana with 30 points. On number first runner-up is Shalin with plus 50. And then on number 1, today's winner is going to be Vinith with plus 70. And on number 4, Shilpi and...
Last question तो quad. हाँ मैम quadratic तो दोनों ही हो सकते हैं superior या inferior quadratic.
Total.
नहीं last question वाला. Last question quadratic वाला field effect.
नहीं वो Quizmaster's decision remains final.
Superior or
Superior or inferior quadrant was not mentioned. It could be either quadrant. It will change the result also.
This question was...
Let's respect the Quizmaster's decision. Rashmin has given. Rashmin Gandhi. So we go by So first, second, third. That is Shalin and Archana and second runner, Shalin.
Again, we would like to thank Ajanta Pharma for supporting us. And Ajanta Pharma, when you make your 5 questions, no, put 5 different products. तब वो उनकी ज़बान पे आएगा, नहीं तो अजंता फार्मा तो आ जाएगा लेकिन प्रोडक्ट्स नहीं आएंगे.